Before entering the room, I'll ensure that the scene is safe. There's no trips, slips, or falls hazard. I declare that the scene is safe. I will close the curtains or the door to provide privacy and dignity for my patient. Approaching my patient, I'll ensure I do my hand hygiene following WHO steps for hand hygiene. Palm to palm, back of the hands, fingers interlace, fingers interlocked, rotational cleaning of thumb, fingertips, and let it air dry for 30 seconds. Now I can safely approach my patient. Hello, good morning, Carol. My name is Paula. I'll be your nurse for this morning. So how are you feeling?
Oh, I don't feel great. I've got chest pain and I feel short of breath.
Right, I'm so sorry to hear about that, Carol, but I am here to do some assessments. But first, I need to check for your identity, please. Are you able to tell me your name and date of birth?
Yes, my name's Carol Young. Date of birth is 24th of the 11th, 1940.
So I can confirm that what you verbalize is same as what's in your ID band and my documentation. I could also see that you're wearing a red allergy band. Can I just ask, do you have any allergies to food, drugs, or latex?
Yes, latex.
So I'm so sorry to hear about that. It's also documented in here. So can I just ask what happens if you get in contact with latex?
I usually get a rash.
Right, okay. So that's also documented. So as you were saying earlier on, so you were having chest pain, or is it just where you're when you're breathing?
Yeah, so when I'm breathing, it's quite painful.
Right, okay. So I will would you know if you had any medications that you've taken?
No, I haven't had anything yet.
Don't worry, Carol. I'm here to assess you as well and to check later on if you have any medications for that. So as I was saying earlier on, I am here to do some assessment as you were admitted because you were having shortness of breath, and as you were saying, you've got also pain while breathing, and you're also receiving 10 liters of oxygen via non-rebreather mask. So are you feeling much comfortable with that oxygen on?
Yeah, a little better.
So that's good to hear. So am I gaining your consent for me to do some set of observations and to ask you some questions for your holistic assessment as well?
Yes.
Okay, so we do this just to make a better care plan for you while you're admitted, and also to get some baseline observations.
Okay.
Thank you. So I'll just I'll give you this call bell, so just press this if you need anything. Meanwhile, I'll just put my PPE on and then we'll start with the assessment. Is that okay?
Yes, thank you.
Thank you. So before doing my A2E assessment, I'll do my hand hygiene again and put my PPE on. So I'll be wearing my apron first. So right, Carol, I'm back. So I have my PPE on. So we'll start doing the assessment. So we'll start with airway. Are you just able to open your mouth for me, please?
Yes, opening my mouth.
I could see that there's no visual obstruction. Are you able to give me a good cough, please? Right? So, okay, so I could declare that the airway is clear. So now we're moving on to breathing. Okay? So, Carol, I might need to ask you if you could just turn your back towards me while I put my palm across your back. Is that okay for you?
Yes.
Okay. I will assist you. Right, Carol? So I will just ask you to inhale, please. Exhale. Okay, another one. Inhale. Exhale. Okay, Carol, I could confirm that you have equal air entry, so we'll just assist you back to your upright position. Is that okay?
Yes, thank you.
Thank you. Also, Carol, I did not hear any rattle, stridor, and there's no active coughing, but I could hear a bit of wheezing as well. I also see a little bit of use of your accessory muscle, respiratory muscle. I did not see any seesaw breathing, cyanosis, or sweating. I will just need to turn on the machine, Carol, and just get your oxygen saturation. So I will use a probe, an oxygen probe, and I'll just put this in one of your fingertips. Is that okay?
Yes.
So I will just use your right index finger, if that's okay for you, so I could do the blood pressure on this side.
Okay.
So I could see that your fingernails, there's no signs of infection or lesion, and there's no false nails or nail varnish. So I'm happy to use that. So I'll just put this blood pressure cuff on. So Carol, am I okay to use your left arm, please?
Yes.
Can I ask, did you have any surgeries or cannulas or fistulas on this side?
No.
Right, okay. So I'm just gonna make sure I use the appropriate size of cuff. And it covers 80% of your arm with 2 finger breadths above the antecubital fossa and between the cuff and your arm. Okay, so I'll start the machine. Carol, you might feel a bit of tightness on the blood pressure cuff, but it won't be long. Okay.
Okay.
It's just the when the machine starts, it starts to inflate. Carol, I will just check for your temperature as well while waiting for the machine to read. So okay, so I'll just put, this is your infrared thermometer, so I'll just check it, point it on top of your forehead so I could see that there's no bruises or skin lesions. I'm happy to use this one. So your temperature is 38.4, Carol. It's a bit on the high side. So did you had any medications for your for temperature?
No, I don't think so.
It's okay, Carol. I'll have a look again after the assessment, and I'll give you some medication for your temperature, just to make sure it's within the normal range. So right, Carol, I'm just gonna remove this now. So your oxygen saturation is 97%, and you're on 10 liters of oxygen via non-rebreather mask. So I'll record that in a bit, and I'll remove this one as well. So for your circulation, your blood pressure is 145/90, so that's within the normal range as well. So for circulation as well, I might need to check for your pulse rate. So I just need to hold it or check it from your wrist for 1 full minute, and then recheck it again for another full minute. So when I recheck it, I just need for you to move your arm across your chest. Is that okay?
Okay.
So I'll be silent during this time, and I'll appreciate if you do the same, okay?
Okay.
So I'm just gonna get, my 1 minute starts now. My 1 minute ends. So Carol, I just need for you to move your arm across your chest. Okay, Carol, so I'll just take another minute to recheck your pulse rate. Is that okay?
Yeah.
So my timer starts now. So my 1 minute ends. Thank you, Carol. So Carol, I do apologize, as the last minute I checked your respiratory rate. I did not tell you, as this could cause alteration to the result if you were aware of it. So I do apologize for that. So the first minute I did check for your pulse rate. So your pulse rate was 90 beats per minute. So it's within the normal rhythm. It's got normal rhythm and good strength as well. For your respiratory rate, it was 23 breaths per minute. So it was a bit on the high side, above the normal range. It's a bit shallow with the depth, but it's got good rhythm as well. So, right? Do you have any questions, Carol? Are you still comfortable?
Yes, I'm okay, thank you.
Okay, so thank you. So further checking the circulation. So I just need to check for your capillary refill time. So I just need to check again. Just apply gentle pressure on your nail beds for 5 seconds. So 1, 2, 3, 4, 5. And it returned in less than 2 seconds. So that's normal capillary refill time. I'll also need to check for signs of pallor. So Carol, are you just able to show me your palms?
Yeah.
I could see that it's pinkish in color, so there's no signs of pallor. Other areas where you could check it is just under the conjunctiva. I'm quite happy that it's pinkish in color. Next one is I will check for your perfusion. So is that okay if I just touch your lower and upper extremities just to check if it's warm to touch?
Yes.
Okay, so thank you. Okay, so it's warm to touch. So you've got good perfusion as well. Okay. So next is we're gonna check for disability. So Carol, earlier on you were mentioning your name and date of birth, which are both correct. So just to further check, do you know where you are, Carol?
Yes, I'm in the hospital.
So that's good. Do you know what date it is today?
It's the 11th of March 2024.
Okay, that's also correct. And last is, do you know what time it is?
1 and 10 a.m. around there.
So that's good. So Carol, all your answers are correct. So I can confirm that you are orientated and alert to date, time, and place. Okay. So earlier on, Carol, you were saying you're having some pain while breathing. Can I just check the pain score as well? So from 0 being no pain and 10 being worse pain, what score would you give it?
I think a 7.
7. So that's a bit on the high side as well, which I apologize and I feel sorry that you are in so much pain. So as I've said earlier on, I'll check if you've got any pain medications and I will straight away give it to you after the assessment. So are you still happy to proceed?
Yes.
Okay. Can I ask, did you manage to go to the toilet to pass urine?
Yes, I went this morning.
And how about the bowel movement?
Yes, I moved my bowels also.
So there's no changes for both, for urine and bowel movement?
No, everything's normal.
Okay, so that's good to hear. Also, did somebody check for your blood glucose level? It's when they prick the side of your finger to get a little blood sample.
No, that hasn't been done today.
Okay, so I'll make sure it's done. So I'll probably do that after the assessment, just so we would have a baseline record of your blood glucose level. Okay?
Okay.
So earlier on, I've checked your temperature, which is 38.4. So I said I'm gonna check if you have any medications for that. But can I just check as well with you? Do you have any bleeds, rashes, bruises, or injuries which I haven't seen throughout the assessment?
No, not that I know of.
Okay. So also aside from asthma and underactive thyroid, is there any past medical histories that I should know of that I
No.
could add to your record?
No.
No. Okay. So we're done with the A to E assessment. So I'm just gonna remove my PPE and document it in your chart. So I've got the call bell as well there beside you. If you need anything, please press the buzzer. Okay.
Okay, thank you.
So I'm gonna remove my PPE, do my hand hygiene, and do my documentation. And do my hand hygiene. So hello Carol, I'm back. So from the assessment that we have done, your total new score is 5 because you scored 20, you have 23 breaths per minute for respiration, which gave you a score of 2. You were on oxygen support 10 liters, which gave you a score of 2. And your temperature was 38.4, which gave you a score of 1. So a total of 5. So we'll be monitoring your observations hourly. Okay?
Okay.
So, and obviously mention it to the team. So also, Carol, I've noticed you have your cigarette and your lighter in here. Unfortunately, this is a non-smoking zone because we have a lot of oxygen in the area and it's highly combustible. I might need to put it in a locked cupboard. So would you want me to give it to you when you're for discharge, or would you want me to give it to your next of kin?
You can give it to my next of kin, please.
Okay, so I'm just gonna ensure I put it in the locked cupboard. So Carol, just to ask further questions for your holistic assessment. So can I just ask as well, how many sticks of cigarette do you smoke a day?
Quite a lot. normally about 20.
So have you considered of quitting smoking?
Yeah, I have thought about it, but I've never really done it. I think I just need a bit of help with it.
Okay, so are you happy to be referred to smoking cessation? Because we have that in the hospital. I can give you a leaflet, and then once you're happy, just tell us, and I'll be happy to refer you to the smoking cessation team.
Yes, please, that'll be great.
Okay. Do you also have? I also noticed from your documentation that you're struggling with walking, especially because you're a bit breathless at the moment. So I will always give you the call bell, and I might need to refer you to the physiotherapist and occupational therapist, just if in case, just to check what sort of mobility aid would you need. And also a commode, preferably at night, just so you don't need to walk up to the toilet. Is that okay with you?
Yeah.
Okay. Also, can I just ask, because it also says there that you were a bit worried with your husband at home. Can I ask, do you have anybody who could like look after your husband while you're in the hospital?
No, not really. I'm really worried about him because I'm usually his main carer. And he's
So-
at home by himself, so I'm really
Can I
concerned.
ask as well, what's the name of your husband?
He's called Dave.
Dave. So we could ask the district nurses to have a look, or the social worker to just have a check on Dave while you're in the hospital. And later on, we could give him a ring. If you give me his number, I'll be happy to ring him for you. Is that okay?
Okay, yes, please.
Okay. It also says here that you're a retired hairdresser. So do you have any other activities with your fellow colleagues before?
Well, I like to meet my friends regularly for a coffee, and I normally go to the gym once a week, and I go to Aquafit, but obviously at the moment I'm just not able to.
Okay. And you don't have any diet restrictions?
No.
So later on, I'll give you the meal plan, or where you could choose what meals you would want while you're admitted in the hospital. Also, can I ask, who's your next of kin, Carol?
Dave, my husband.
Dave, your husband. Okay. Do you follow any religious beliefs or practices?
No.
No? It's okay. We also have some chaplaincy services if you would need to talk to somebody, or just have somebody to visit you. I'll be happy to refer you, or to give them a ring for them to visit you. Is that okay?
Okay, yeah.
Okay. Is there any concerns at home or with you and Dave that you need help with or assistance with?
No. I'm just worried about him being on his own at the moment, that's all.
Okay, so I will ask for the district nurses and the social worker to have a check with Dave, and we'll ring him later on, just so we could lessen your anxiety and your worry about Dave. But for now, we'll focus on keeping you better, so you could be discharged as well. Okay?
Okay, thank
Do you have
you.
any other concerns?
No.
Okay. So again, Carol, thank you for your time. We've got the call bell beside you. If you need anything, please press that. I will just escalate everything to the doctor from what I have documented from your assessment. Okay?
Okay,
Thank you for your time.
Thank you.
Just gonna end my station.